Hi, I'm Cassondra Taber, and I will be discussing ethical dilemmas in DNR orders for children. Do not resuscitate, otherwise known as DNR, orders and end-of-life decisions for children involve multiple ethical dilemmas in healthcare. Studies have shown that there is great reluctance to enter a DNR order for pediatric patients, as they are so ethically unique. As we learned in our text, legal and ethical issues for health professionals, the definition of DNR is the determination as to futility of medical care is a medical decision based on scientific evidence that further treatment is futile and one's quality of life has been so diminished that heroic rescue methods are no longer in the patient's best interest. DNRs are made at the family's request. If a patient lacks the ability to make such decisions, a patient's legally appointed decision maker can make those decisions. DNRs tell physicians what to do if a patient stops breathing or if their heart stops, and they mean well, yet they are also problematic. Objectives. In my final research paper, I will present research on 4 legal and ethical dilemmas involved with DNRs in children who have life-threatening illnesses. I will also discuss the broader dilemma in parents making that decision for their children. I will address the influence DNRs may or may not have on patient care, and I will consider the Christ-centered worldview on DNR orders. DNR issues and decisions are certainly troubling with no easy answers. Ethical dilemmas. The first ethical dilemma in DNR orders for children is the consideration of who makes these decisions. As we stated, for a child that is unable to make these informed decisions on their own, their parents can make those decisions on their behalf. The parents are desperate to do the right thing, they're desperate to save their child, and often they don't have adequate resources or the information that they need to make a good informed decision regarding the care and end-of-life decisions of their children. The second ethical dilemma in DNR orders for children occurs when the medical team and the parents disagree on the best course of action for the child. Studies have shown this has gone both ways. There have been instances where a parent will stop at nothing to prolong the life of their child, even when they know that they are terminally ill and that death is imminent. It's also been the case where physicians have wanted to do more for the children in their care, striving to make parents more aware that there are more options available and that they believe that the best course of action for the child is to continue care, and then parents have disagreed. The third ethical dilemma in DNR orders for children that influence DNRs have on patient care. Clinicians have reported that the care of a patient changes once a DNR order is written. One major change is that there's a greater focus on comfort, but there's also limitations or withdrawal on other appropriate interventions. The fourth ethical dilemma in DNR orders for children is that clinicians are ill-prepared and reluctant to have these end-of-life discussions with families. Having a child with a life-threatening illness can be frightening and stressful. So when they're in the hospital, they expect that their providers will be open and honest in providing them with the information they need. But clinicians are not ready. In a survey I read, 88% reported little to no structured training on the DNR status discussions during medical and nursing school. So often they lack the ability and they lacked appropriate tools to document patient goals for end-of-life care and to really have those conversations with parents. Broader dilemmas. There is a broader dilemma in parents making DNR decisions for their children. Children ages 7 and older have the capacity to voice their end-of-life wishes, that is, if they are asked. Parents do not want to give up hope, and there is a great fear in death in general. Facing the most difficult path they may ever walk through, parents struggle with support in making a request for DNR orders. Clinicians surveyed reported that parents have unrealistic expectations and a limited understanding of the prognosis. However, physicians do not always provide adequate information to help parents make informed decisions. Ideally, these decisions would occur in a timely manner with the family and care team present. Legal issues. A physician must always act in the best interest of their patients and not on his own beliefs, as he will ultimately be responsible for his treatment decisions. There are some cases where a physician will want to continue treatment of a very critically ill patient, but they will find themselves in a very difficult legal situation if the child's parents withhold consent. When it becomes evident that a cure or acceptable quality of life is no longer possible or expected, the focus of care changes from prolonging life to ensuring a dignified death. Any reluctance to place a DNR order may prolong the suffering of a child and robs them the opportunity to have as much of a quality of life as they have left and the opportunity for dignity in their death. Christian worldview. As we consider some of the ethical dilemmas in DNR orders in children, we have an obligation and a privilege to consider our Christian worldview in making such decisions. As painful as these situations are regarding the end-of-life decisions on behalf of pediatric patients, we know that no one cares for these children more than God. A decision to order a DNR for a child must be based on a Christ-centered worldview of this child being made in God's image. I also think it's important to consider the reasons that DNRs were placed and why they were implemented in the first place was to prevent any suffering. So as we make these decisions and look to those who are making these decisions on behalf of our children and other children, we hope that they would pray for wisdom and guidance from God. James 4:14 says, "Yet you do not know what tomorrow will bring. What is your life? For you are a mist that appears for a little time." John 14:27 says, "Peace I leave with you, my peace I give you. Not as the world gives do I give to you. Let not your hearts be troubled, neither let them be afraid." In these decisions and other decisions, I believe that God would grant us his wisdom and give us peace to guide us. In closing, we must do better for the sake of children who are the most vulnerable patients. We must do better as healthcare providers and change makers to ensure that the definition of DNRs is well understood by all who play a part in the child's care. We must provide better training on how best to handle these end-of-life decisions and conversations surrounding. We must consider the end-of-life wishes of children so that we can honor their wishes, so that they can avoid further suffering, and so that they can have dignity in their death. I'm thankful for the promise of heaven and that this is not our home, and that in the midst of these very difficult decisions, our God goes before us and he is with us.